Road traffic collisions are daily occurrence in many countries, including Pakistan. Most collisions occur in the young and involve two-wheeler riders or passengers. In Pakistan, the most common causes of road traffic collisions are related to disobedience of the traffic laws such as speeding, not using personal safety equipment such as helmet and seat belts, triple riding, wrong way riding, using mobile devices while driving or riding. Other factors that contribute to collision includes poor quality vehicle which lacks safety devices, poor quality of roads, obstacles on road such as non-illuminated barriers.
बहुत सारे वजूहात होते हैं। मसलन हमारे पास जो हमारे राइडर्स होते हैं, ये मोटरसाइकिल वाले, ये हेलमेट नहीं पहनते, बकाया ज़्यादातर वालिदैन जो है वो भी लापरवाह होते हैं, उनके टीनेज में उनको गाड़ियाँ दे देते हैं।
In our society, using the helmets, only the government when it starts fining, so then they use. Otherwise, as a safety, personal safety, they are not being observed.
Road traffic collisions can lead to many kinds of injuries, some of which result in death. The most frequently seen and treated type is injury to the head or traumatic brain injury.
We see almost more than 600 patients per year in our ICU, and almost 50% of those patients are those of road traffic accidents. Now the patient presenting to us are usually having multiple injuries, multiple organ system involvements like neuro trauma, chest trauma, lung trauma, abdominal traumas, and due to that, average hospital stay, ICU stay, cost of the treatment, and all the things go up.
The impact of road collisions, especially when there is a traumatic brain injury, is quite devastating, where it can only lead to death but can also lead to disabilities if the victim survives.
Unfortunately, all these patients are very young. The second unfortunate thing is that majority of them are bread earners of their family, which actually have an impact on the family itself. Apart from that, the persons who are supporting them and they stay with them in the hospital. So all these things cumulatively make a big financial loss for the family.
The large number of road traffic collisions and casualties can burden the current healthcare system. In addition, the disabilities from road traffic collisions, especially when there is a traumatic brain injury, are long-lasting and require long-term care, which also can stretch and strain healthcare resources. Financial constraints and the loss of health will also affect the mental state of the victim and their families. Since road traffic collisions and traumatic brain injuries are such devastating events, steps must be taken to reduce this problem in the community and country as a whole. All road users should know what the road signs are and what they mean. Families and schools should play a role in educating the young about road traffic collisions and the consequences. Healthcare professionals should be willing to lead and participate in educational efforts, using the media to share messages on preventing road traffic collisions and traumatic brain injury. Strict implementation and enforcement of law, which can be achieved through proper training of police, providing incentives for police officers to enforce the law.
To reduce road traffic accident, I think two things are essential. One is that we should have strict regulation regarding issuing driving license to appropriate people. Secondly, the traffic rules should be applied across the board so that anyone who violates traffic rules does not get away with it. In order to do that, I think we need to have social public awareness campaign so that people get to know the traffic rules. We need to have good traffic schools where traffic rules and driving is taught to people, appropriate people, so that when they come to licensing, they know what is required of them.
All roads should have proper road signs. Traffic management should be part of town planning. Organizing one standard emergency medical service to provide proper pre-hospital care for victims, especially those with traumatic brain injury, ensuring easy and quick access from the scene of injury to the nearest appropriate healthcare service which is equipped to treat the injured victim. More research should also be done so we can have hard data on extent of the problem, its impact and outcomes, and any gaps in the current prevention system so that the government and relevant organizations can plan and implement the necessary policies. The prevention of the road traffic collisions and traumatic brain injury is everyone's responsibility. Whether you are the government, a healthcare professional, an educator, member of an NGO or private organization, the media, a religious leader or member of the public, let us all work together to reduce road traffic collisions and resultant traumatic brain injury in our beloved country.